So in this video, I'll be taking you through the latest developments concerning the retrial of the nurse Lucy Letby. Lucy Letby is currently standing trial on one count of attempted murder. The information provided in this video is from the live reporting taken directly from inside the courtroom. Today, the prosecution will continue to present their evidence. Analyst Kate Tyndall is talking through the sequence of events. Each juror has an electronic copy of this. The sequence of events includes timestamp details of clinical records, staff movements in the hospital, medicine administration, text messages, and significant events in relation to child K. It also notes which clinical staff has recorded medical notes. The jurors are shown a document concerning a prescription for morphine. The officer agrees that there will be evidence later in the trial that the signature is not from the nurse it purports to belong to. The jurors are shown two prescriptions for child K signed by a nurse and countersigned by Lucy Letby. 3 updates were made on the computer records for the infant's medication, the jurors are told. A pathology sample was also taken. Letby recorded entries concerning another baby at around 5 a.m. Another note on the record refers to photos being taken of child K, which the jurors are told accords with evidence given by child K's mother last week. Child K was later given medication to help her lungs. At 5:50 a.m, samples were collected from the infant for analysis, but nothing was said to have been detected from these samples. A handover note from Dr. Ravi Jairam touches on the intention to move child K to a specialist hospital. The transport team enters a note on the system of a call from Dr. Jairam which mentions the infant dislodging a tube. A detailed update from Lucy Letby is then made on an admission form for child K. The jurors are shown a copy of an X-ray of child K. At 6:25 a.m, Letby and another nurse made an entry on the system concerning an infusion of saline. Later at 6:37 a.m, Letby recorded herself giving medication to 2 other infants. It was then confirmed that child K would be transferred to the specialist Arrow Park Hospital in Birkenhead. The jurors are told a note from Dr. Jairam had recorded that an endotracheal tube had gone into child K's mouth to a depth of 10 centimetres rather than the usual depth of 8.5 centimetres. An ambulance was booked to transfer child K and another X-ray was taken of the infant to confirm the position of the endotracheal tube. The ambulance arrived at 8:05 a.m. and the transport team arrived at 8:50 where they were given a handover by Dr. Jairam. The parents of child K were given an update and more observations of their baby were taken at 9:30 a.m. At 10 a.m, notes from the transport team record details of her treatment, including that she was being given 90% oxygen. At 10:50 a.m, more notes catalogue the medicines being administered to child K. At 11:10 a.m, the transport team notes also record the medication and quantities. At noon, child K was moved into a transport incubator. The parents saw their baby go into the ambulance and depart for Arrow Park Hospital. She arrived at 1:15 p.m. Her mother left the Countess of Chester for Arrow Park when she was discharged at 2 p.m. The jurors heard that Lucy Letby texted a colleague at 5:48 p.m, quote, "That 25-weeker delivered, so fairly busy." Some 3.5 hours later, after there had been no reply, Letby texted the nurse, "Everything okay? Not like you to not text back." The nurse colleague replied, "Oh sorry, lol," and in another message said, 25-weeker gone out now. Letby was said to have replied, "Yeah, but not until 2ish and very unstable." The jurors were told that the defendant made a series of searches on Facebook concerning the baby she is convicted of attacking. In another search, said to have been conducted 2 years and 2 months after child K was transferred out of the Countess of Chester Hospital, the defendant is alleged to have searched the surname of child K. Analyst Kate Tyndall talks through some additional documents which the jury have in their document collection. It includes all of Lucy Letby's recorded duties and the location of all babies on the neonatal unit on the morning of February 17, 2016. Prosecutor Nicholas Johnson explains the purpose of the entries is so it can record where the neonatal unit nurse was at various points throughout her shift. Entries highlighted are all events concerning child K, such as the admission to the neonatal unit, communication with parents, observations, and infusion. Initial entries do not have any Lucy Letby involvement, but Letby is later involved after child K is admitted to the neonatal unit. Dr. Sarah Brigham, consultant gynecologist at the Countess of Chester Hospital, is called to court to give evidence. Prosecutor Simon Driver asks her if, from memory, she remembers child K or her mother. Dr. Brigham replies she does not. Dr. Brigham explains her role and duties within the hospital, which involve overseeing high-risk pregnancies. She had reviewed the mother of child K on February 15th, and the plan was to administer a range of medication to slow down the process as the mother presented in preterm labour, and arrange for the mother to be transferred to a tertiary Level 3 centre. Dr. Brigham says the Countess of Chester Hospital accepted babies from 27 weeks gestation as a Level 2 unit at the time, whereas Level 3 centres optimally accepted babies of 25 weeks gestation, which child K was at this stage. A Cheshire and Merseyside perinatal cot bureau note records on February 15th that the planned transfer was cancelled, patient unstable to transfer. Dr. Brigham says the risk was the patient would deliver in an ambulance as the labour was progressing. The chosen Level 3 centre at this point would have been Preston. She agrees it would be preferable for child K to be born in a Level 3 centre, but it was better for the baby to be born in a Level 2 centre to the back of an ambulance. She adds that preterm labour can be very unpredictable. An examination of the mother on February 15th showed the mother's waters could go at any stage. Dr. Brigham says the choice not to transfer child K's mother to a tertiary centre was in the circumstances the correct one. She says even with hindsight, based on the clinical conclusion at the time, it was the right choice, and she stands by her judgment. Mr. Myers for Letby's defence rises to ask about the transfer. Dr. Brigham agrees that in an ideal world the transfer would have taken place. Mr. Myers says that choice was made on the afternoon of February 15th. He says, as it happened, child K was not born for another 35 hours. Dr. Brigham says the mother was lying in a bed at the time, and the process of transfer from the bed to an ambulance could have caused the labour to progress. Things can change very quickly, she said. Dr. Brigham reiterates the choice not to transfer was the right one. In Chester, the care was then optimised for child K's mother. Nurse Yvonne Griffiths is the next to give evidence. She is currently ward manager at the Countess of Chester Hospital. Mr. Driver explains he's going to pick a few points from her witness statement and ask about those. Yvonne Griffiths talks about the nursing skill levels, with higher levels able to work in intensive care and high dependency units at the neonatal unit. She says it would be important to speak to the parents and get maternal history as soon as they could, once they were made aware it would likely be a very premature baby's birth was imminent. Yvonne Griffiths confirms the electronic nursing records, with the initials LL as their author, show it is Lucy Letby who has written them. Yvonne Griffiths explains 2 nurses calculate the medicine infusion for babies together, with both signing the form. Mr. Driver asks if that means there is a safety net, so babies aren't given the wrong dose of medicine. Yvonne Griffiths agrees that is the case. Mr. Myers, on behalf of Lucy Letby's defence, rises and says, at the time in 2016, Yvonne Griffiths was Deputy Ward Manager. Asked about the vulnerability of such babies in the neonatal unit as child K, Yvonne Griffiths says they are just so fragile, you need to monitor them constantly. Mr. Myers says a desaturation is not uncommon in a neonate. Yvonne Griffiths agrees, and agrees that such desaturations can happen within seconds. She adds it's a hands-off technique for such neonates, as handling them could cause stress, and that is why they have electronic monitors. Yvonne Griffiths agrees a nurse can wait to see if a baby self-corrects when it desaturates, paying attention to the skin colour of the baby as an additional observation. If the situation does not resolve, then an intervention is necessary. Yvonne Griffiths agrees. Mr. Myers asks about nurses leaving babies alone. Yvonne Griffiths says that can be done if the baby is stable and telling a nursing colleague if they are going to be absent for a short period of time. Yvonne Griffiths agrees with Mr. Myers there is nothing unusual in going from one neonatal unit nursery room to another to help a nurse in another room, as is shown during Letby's night shift when she assists in room 1 of the units where child K was. One of those times where Letby assisted in room 1, Mr. Myers says, was recorded before the arrival of child K to the neonatal unit. Mr. Myers asks about the floor plan of the neonatal unit, including the layout of the nursing stations which can be used to update computerized records and where morphine is stored. He asks about a prescription for medicine administered to child K. Yvonne Griffiths agrees that the time of the prescription recorded is not the time the medicine is actually administered. Mr. Myers asks how incidents are recorded on the unit. Yvonne Griffiths replies it is via a Datix system. Mr. Myers says that enables doctors or nurses to record concerns during the course of their duties. Yvonne Griffiths agrees. The court hears the process is done online. An example of such a Datix form is presented to the court. Mr. Myers says once one of those forms is completed, they can be raised with the heads of department. Yvonne Griffiths agrees. Simon Driver rises to clarify a couple of matters. The self-correct process referred to in Mr. Myers' questioning is raised. Yvonne Griffiths says with a baby brand new to the unit, you would be aware of any desaturations. She adds, you would want to watch that carefully. And with a baby of child K's prematurity, that would be watched very highly. The judge apologises to the jury for overrunning, saying they would normally be finishing by 4:30 p.m, but witness availability required the court to overrun. He reminds jurors not to research anything about the case or discuss it with anyone. That brings today's proceedings to a close.